Dr. Jeff Power. The business is Angelo Back and Rehab. I'm a doctor of chiropractic here in the office. The doctor of chiropractic works on the body to help it work more efficiently and effectively. And so by coming in, doing an exam, we can find areas of the body that aren't working like they're supposed to. And we can begin to work on those to cause the body to work more efficiently. Yes, chiropractors go through the same undergraduate studies that a medical doctor would go through, and then we have a 4-year postgraduate program that we go through to become chiropractors. Most of the time they can self-refer or just come in, give us a call and come in. But our staff is very good about working with the insurance company. And there are some that you have to have your PCP, your primary care physician, refer you to anything that you do. But other than that, you can come directly to a chiropractor. Just like with any other doctor, I think referral from a trusted friend is one of the best options. We also have, you can come in and sit down with us and talk to us at any time. So as a patient first enters our office, they're going to, of course, fill out some paperwork so that we know a little bit of their history. As they come in, of course, we're going to give them a tour of our office and show them exactly what's going on in our office. And we'll sit down and talk to them about their history, and we'll ask them things about how long it's been going on and where, of course, exactly where the pain is. And then we'll do a thorough exam, making sure that we understand exactly what's going on, which joints involved, and we want to take some pictures so that we can visualize where the bones are, and if they're twisted or rotated or whatever in the spine or in the extremity. And then from that point, we're going to sit down and evaluate all that and recommend a plan of care that will help them to get out of pain and then continue to stay out of pain from that point. So. Well, of course, there's always the neck pain, the low back pain, the headaches, those types of things. I think the percentage is 85% of the population has back pain at any one time, and 1 in 3 has neck pain, and so those are going to be the most common. A lot of what we see is people that do sit at a desk a lot during the day, and so their posture is their legs and hips are bent. A lot of times they're leaning over a desk, their shoulders begin to slump forward, their head is forward, and their arms are on the desk. And so it stretches everything, the postural muscles out in the back, and they become almost too limber. And then they try on the weekends to do, rebuild the whole backyard fence in one weekend, and they can injure their back a lot from that because their back is not conditioned for that type of work. So we do go in and take pictures to see if there's any degenerative changes that go on in the disc and the joints. And depending on that, we typically recommend a schedule of care. Most of the time we start out about 3 times a week. We usually go through about 12 visits like that. Part of what we do is trying to retrain the body to move correctly again. After that, we begin to taper it off to where we can just maintain that spinal health that we've created with one adjustment every month, every 3 months, something like that. The healthier you stay, the less you'll spend time in the doctor's office just in general. Exercising, our bodies weren't made to sit behind a desk, and so if we do sit behind a desk most of the day, if you look at the posture that you're in throughout the day, maybe do a little bit of that, opposite of that. So if we're sitting all day, we want to exercise more in a standing position. If we're stretching, we want to make sure that our back stays limber, and so some stretching is called for there. Well, even as a chiropractor, I can't work on my own body, and so all I can do is make sure that the areas that continually get tight, especially with sitting, the hip flexors, the hamstrings because of bent hips and knees, the back that gets loosened up, we need to strengthen that back up to help the posture in there, stretching out the front where we continually have our arms forward and our head forward. We need to stretch out the front of the chest and strengthen up the back. And so as we go throughout the day, we need to kind of pay conscious attention of what things are being stretched, like our quad muscles here as we're bent. My knees bent, my quad's getting stretched out. I need to strengthen that up some. And your glute muscles, as you sit on them all day, they can get kind of glute amnesia. And so we need to exercise those and kind of rebuild that firing pattern to keep them strong, and then stretch out the muscles that we continually keep tight by sitting. And so by just looking at what we do on a daily basis, we can help ourselves a lot by stretching out those areas that we keep contracted and strengthening the areas that we keep stretched out throughout the day. The address here is 3950 Sunset, and so we're kind of across from the mall. We're directly across from Red Lobster. Our hours here are 9 to 6, Monday through Friday. So we're here all day, every day.